Anderson, and my partners are Tanner Milken and Jacob Loomis, and we did our presentation on infant jaundice. So the cause of infant jaundice and any jaundice in general is hyperbilirubinemia, which is the excess levels of bilirubin in the body. Bilirubin is a yellow pigmented compound that's released when red blood cells break down in the body. So that's how that happens. And most of the times in infants, this is caused by biliary atresia, which is a blockage in the duct that transports the bile. So if you can see, there's the liver up here, and then this little green duct there is where that clogging takes place. It can also be caused by hemorrhage, sepsis, or enzyme deficiency. The most common symptom is obviously the yellowing of the skin or whites of eyes. So as you can see in the picture, the baby on the left has red tinted skin and looks healthy and normal, and the one on the left that has jaundice is really yellow. There can also be pain in the abdomen, and so they would test that just by pushing on the baby's abdomen and seeing if there's any discomfort. They can also test abdominal cramping by doing that as well. Also, there could be lack of interest in feeding in the infants, weight loss, nausea and vomiting, dark urine, or fatigue. The diagnosis, they're usually just diagnosed by their appearance because, as I stated previously, they'll have the yellow tint to their skin or the whites of their eyes. But if they need to do further testing, they can run blood tests, which will show the amount of bilirubin in the body, or they can use the transcutaneous bilirubinometer test, which will show a reflection of the light of a special light that they show, and that can also show the amount of bilirubin that's in the skin. For treatment, a lot of times they'll just encourage to make sure that the baby's breastfeeding enough and getting the hydration and nutrients that they need, because a lot of times that's a problem, and that can a lot of times cause the jaundice to get worse. And also they can use phototherapy, which uses fluorescent lights, and then that can reduce the levels of the bilirubin in the body through something called photooxidation. And then in severe cases, they can do exchange transfusion or intravenous immunoglobulin, which acts as an antibody that fights off some of the extra bilirubin in the body as well. And then for prognosis and follow-up, it really depends on the case. Each case can be different depending on what's causing the jaundice to take place. A lot of times there can be a full recovery, but sometimes it could be fatal, or there would be surgery needed, but that's only in super severe cases. And just some follow-up questions to make sure that this jaundice doesn't reoccur or that it doesn't affect the baby's health in the future. Just making sure that the baby's well breastfed, and just checking in on their diapers if they are using the bathroom a lot, because again, like I said before, a lot of times they're dehydrated, so getting that hydration, there will be more diapers going along with that. And also, how often does your baby wake up for feeding, and do they seem sick or weak at all? And our sources are Mayo Clinic.